La Crosse County health experts say this spike in cases is, again, unlike anything we've seen during this pandemic.
And once again, they also say it is likely to get worse before it gets better, even if people start taking the right steps now to stop the spread. News 8 Now's Mayo explains why health experts say we need to act now.
La Crosse County is at a crossroads.
We just have to get back to following the guidelines.
The positivity rate is up from 16.3% last week to 27.2% this week, meaning there's an increase in infections.
When it's at that level of positivity, we know that community spread is pretty strong.
The COVID-19 case rate nearly doubled from last week, with an increase in case rate across all age ranges in almost every municipality.
We're seeing older people get infected now than we did earlier in the fall.
In the last month, there have been 52 people hospitalized out of 134 total throughout the pandemic.
The more the spread there is, the more likelihood people will be hospitalized with COVID. And unfortunately, more likely they'll die.
Where previous spikes were caused by the return of students and large gatherings, now it's about family gatherings, dinner parties, and attending weddings. It's likely being spread by people who are asymptomatic or pre-symptomatic.
They're spreading the virus, and they're doing it in day-to-day activity. Going to the grocery store, going to gatherings.
If things don't change, hospitals will have to scale back, potentially limiting elective procedures like they did in the spring. Back then, they were concerned about having enough PPE and supplies, but now it's about staff getting sick in the community.
You need professionals to take care of sick patients, and you need staff to do that.
The county was able to flatten the curve after a spike in mid-June and again in mid-September.
This time is much worse, many orders of magnitude worse.
Health experts from both hospitals say even if you have resisted precautions before, there is time to change, but you have to do it now. In La Crosse County, Mel Meyer, News 8 Now.
Since symptoms can take up to 2 weeks to develop, the increase in cases could continue to climb. With the delay, hospitals are prepared to see more people needing help later in the month.